Language interpreter is Damian Evans. Kenya continues to record a high number of positive cases as well as deaths, despite the various containment measures in place. Over the last 24 hours alone, 278 positive cases were recorded, a figure that is now worrying the government. And as Dr Mercy Korir reports, the spread of Covid-19 has not spared hospitals, either with Shalom community in Athi River being temporarily closed over its capacity to handle Covid-19.
As Kenyans try and go about their lives, so does the Covid-19 in its attempt to wreak havoc, as seen by the 278 confirmed positive cases out of the more than 4,000 samples tested over the last 24 hours.
Nairobi leads with 171 cases, Mombasa has 37, Nakuru 17, Kiambu 12, Busia 10, Uasin Gishu 9, Kajiado 4.
At Shalom Community Hospital in Athi River, this virus brought services to a halt. Relatives who had come to collect the remains of their loved ones for burial this morning had no clue that the hospital had been sealed off overnight by the Kenya Medical Practitioners and Dentists Council over COVID-19 related deaths. It wasn't until midday that there was some motion. They could pick up the bodies, but the fate of the 180 patients and staff still held up in the hospital remained uncertain.
And I was notified, and I came back. Only realized that I cannot enter, nobody can enter, nobody can get out.
The night staff and patients at the hospital were sealed in at 9:30 p.m. due to what the government agencies term as inadequate preparedness by the hospital to handle COVID-19 following 3 deaths in the last 2 weeks and 3 more positive patients and a staff at the facility whose isolation status has not yet been determined and approved.
In this particular case, there was cross-infection, and our teams are currently on the ground as we speak. We have actually curtailed any further admissions.
The hospital has been accused of not alerting health officials of their COVID-19 situation, in addition to having inadequate and trained staff without the required personal protective equipment. The hospital has, however, denied all this.
We usually follow the protocol. When we suspect them from our fever clinic, we usually report to the county through the sub-county.
While the hospital cannot admit and attend to new patients seeking services until the assessment by the Ministry of Health is concluded, the patients who have been locked in will continue with their care uninterrupted as they await the results of the mandatory coronavirus testing that is to be carried out. Staff will be quarantined in a nearby hotel to allow another set of staff to attend to these patients. The temporary closure of Shalom Community Hospital under these circumstances is perhaps a wake-up call to both national and county governments on the need to have all its facilities, both private and public, adequately prepared to handle the COVID-19 pandemic. Dr Mercy Korir.